Good afternoon, guys. My name is Peter Ashby, and I'll be doing my paediatric assessment triangle scenario online with you. So, first things first, classic scene safety. Scene safety will be going throughout the entire job, but to start off with, you want to be making sure that you're safe to go in and get out again. So you're going to be looking around for dangers. PPE, currently we're in droplet precautions for most jobs. Anything respiratory, we should be using droplet precautions. However, currently I'm using droplet precautions for every job because you don't know what you're going to get. Considering our egress is part of scene safety too, you got to make sure you can get out. Okay, so introducing yourself to parent is super important. Building rapport very quickly with parent, super important. Making sure they trust you, super important. Consent with a parent, just having implied consent, so they've moved towards you or let you into the room. They've helped you locate the patient to go, this is my child, this is the one who's sick, and this is what's wrong with them. That's consent for you to come in and have a look at the child. I never take the child away from the mum, only because it helps me with other things down the track, GCS scores, etc., etc. At this point, if you haven't already seen obvious life threats, then you better open your eyes. Child's bleeding or is laying there like this, obstructed, and you think they're in arrest or they need work right now, you should be addressing it. Pediatric assessment triangle can commence at this point. It takes like 5 seconds. You're assessing their airway so you can hear. If your ears are quite good and you get all the noise out of the room, you can hear croup, you can hear asthma wheeze, you can hear obstruction, medical and physical obstructions. So that's your airway portion, and then your work of breath is obvious too. The way the child's holding themselves, the way they're moving, whether they've got tracheal tug, whether they're using accessory muscles, or they're just knackered from just working hard, and also their pallor. You should have the light on. Check out their colour. Are they pale? Are they cyanotic? Is that modelling on their arms? Are they perfusing? At this point, I always do a quick pause point. Do I need an intervention now? Usually if you've got a good partner, they're already started drawing up something if they hear the croupiness, or drawing up adrenaline, should I say, for the neb, or they're drawing up a salbutamol neb already for you, ready to go, or passing you something to give them oxygen. Do I need IC? It's important. Got a pause point to go, is this child really sick? When they're holding their body all floppy, help, I need help. If they're not that dramatic and you're not going to hit intervention straight away, then you go into your secondary to slow it all down and try to keep everyone calm and chilled. Airway, breathing, circulation, classic. Get them to stick their tongue out, they hide and go, no, and you're like, stick your tongue out. Yeah. So you want to have a look at their mouth. You want to assess their breathing, whether, all their lung fields are working. This is my stethoscope. Have a little listen, confirm whether you do hear a wheeze, whether it's confirm that it's not lower respiratory here. At that point too, have a little listen to their heart. That'll help you with circulation. You can hear their heart ticking away and you can get a pulse rate. Have a feel of their arms for circulation. With that, feel for heat, feel for coolness, feel for dampness. Check out their brachial if you can't get it at their hand. You can sometimes see in their the skull hole. Yeah, you sometimes see the pulse in their head. Disabilities for children, GCS is different because of their cognitive difference. With adults, they're usually language deficits comparative to the adults. Parents will tell you too what their normal is. Don't just assume, oh, that's a 4-year-old, they should be able to speak. Ask the parent what's normal. So eyes are exactly the same as adults. Verbal, I use this is my favourite tool. So if they interact with you and look and respond normally, hello, as they normally would, cool. Toys are always work. And also, if they grab this, they get a top score for their motor anyway. So get your torch out, get your lad out. I expose a child. If they're not exposed, you should take all their clothes off, get their nappy off, hell, have a good look around. You're looking for rashes, you're looking for bruises around the soft areas that shouldn't be there, you're looking for grip marks, circular grip marks. bit of a red flag. Also, at this point, you know whether your child is, you've got suspicions the child's unstable, stable. You can get that CUPS assessment done and figure out whether you need to move your tushy out of there. And again, this is another pause point to go, I think I'm going to call IC for this to meet us somewhere. If you don't need that, you can do your vitals on scene. Make sure you get your vitals, get your baseline, do your sample. Mum's going to already told you half the sample. Run through your sample again. So you've ticked all the boxes, because sometimes you have multiple parents telling you what's going on. And at that point, you know what hospital you should be going to and how you want to extricate this baby, whether you've got time to go get the blue book, you've got time to go make sure everything's sorted, and off you trot to hospital. The end.